Hi everyone, welcome to the NHS Southport Formby CCG's annual review for 2019-20. Next slide please. My name is Rob Cordwell, I'm a GP in Southport and chair of the CCG, and I'll just say a few words about the event that we've got planned for this evening. Next slide please. Okay, so just initially, the first things about the event. We are recording this, so it will be uploaded to our website and it'll be able to be viewed at a later date from that. We're going to present an overview of the year that we've just had, 2019 to 20. And then finally, we're going to answer some questions that have been submitted in advance. So at the end of the presentations, we'll be answering those. Next slide, please. Okay, so I'm going to just do this brief introduction and then give some highlights from my perspective as chair. I'll then hand over to Fiona, our chief officer, who will give an overview of the year we've just had and where we are now. And then I'll hand over to Martin, our chief finance officer, who will go through the performance that we've seen in the last year. And then we'll be dealing with the questions, as I've mentioned. Next slide. Okay, so over the last year, it's been a really important one for GP practices. There's been a lot of changes and a lot of transformational work looking at how we offer care to our residents, and GP practices have played an increasingly central role to that. We're all working together much more than we have done traditionally, and those arrangements have been strengthened through primary care networks, which are known as PCNs. Really so that we can achieve more by working across bigger population areas and working together, pooling our resources and our expertise. There's a lot of new ways of working that we've been looking at and new roles that we brought into practices to offer a better and a more integrated care journey for our patients, and they are directly benefiting the patients. Some examples of that are the Medicines Hub, which is highly qualified pharmacists who offer us support and offer support directly to patients, looking at medication issues, actual medications, availability of medications, best ways of taking medications, and can review patients' medications with them so that they get the best from them. We've got social prescribing link workers who are able to go out and see patients, speak to them, and look at some of the wider issues that might be impacting on their health and help them to deal with some of those. And we've also got a lot of improved digital access. The next point really has demonstrated the need for that. We've had COVID to deal with. We are open, the NHS is open, and we want people to present themselves if you've got concerns or symptoms that you're worried about. But because of COVID, we're having to do that in a different way at the moment to make it as safe as possible for our patients and our staff. So some of that is through new digital ways of accessing primary care, and secondary care is doing the same thing. It might be through telephone or video calls, but I think the key message is that we are still here for you as an NHS, and we would encourage you to access us as you would have done normally, and we will lead you through how we're now managing care. If you need to be seen, you will still be seen. Next slide, please. We haven't been able to hold our usual big chat engagement events as we have done every year since the CCG was started, sadly due to the COVID-19 pandemic. We're hoping that these presentations will give you a good overview of what we've done and all the work we've been doing in the last year. And the annual report and accounts for the last year will also be available on our website, which I'd encourage you to go and have a look at and read. Next slide, please. Okay, I'll now hand over to Fiona Taylor, the Chief Officer of the CCG, who will tell us a bit more about the year we've had and where we're up to now. Thank you. Okay, Fiona.
Thank you, Chair. Welcome to our AGM, as the Chair said, and just before I start my presentation, I just want to say to each and every one of you out there, thank you for all the support you've shown to the NHS. Certainly standing on the doorstep way back when the COVID pandemic started, it certainly was a morale booster. I'm actually going to be referring to the previous year, which seems like a lifetime ago. So this is the year that ended the end of March 2020. So next slide, please. So during 1920, we pulled together a 5-year plan called Sefton Together, and this was produced very much in partnership with our local authority through Sefton Council, and very much complemented the work of the Health and Wellbeing Board, of which we are a key partner to support the vision for Sefton and for our residents. We also worked really hard in 1920 around quality of care, and some of our improvements which we were proud around included our dementia care, and we were ranked 7th nationally, and we also gained some recognition for the progress in cancer survival rates and some of the work around our mental health indicators. Not only that, we were also a finalist in the Local Government Association Awards for a supported living service, which was a real pleasure and delight to be put forward for this award, as this was about transforming the lives of some of our most vulnerable residents. And we won in 1920 thanks to the work of Dr Anna Ferguson and Jenny Owens in the CCG. Trans Health Sefton were the winners of the National Healthcare Transformation Awards. So we're quite proud of that achievement in the year. Next slide. So this is our Sefton Together, Shaping Sefton 2. When we became CCG back in 2013, we had to have our thinking, our strategy, our plan, what we were going to do. What we were going to do was to try and tackle health inequalities and improve health outcomes for you as our residents. And this was our second iteration, which came to fruition at the end of December 2019. So it's just nearly a year old. And this was a response to the NHS England ask that all places and all clinical commissioning groups had a 5-year strategy. So this builds on Shaping Sefton 1 and builds on our vision that we are much more integrated health and care, so working closely with children's social care, adult social care and our other partners and colleagues and community voluntary faith sector to make sure we're wrapping as much as we can around our local communities and putting communities and our primary care networks and GPs in the middle of that action and making sure that that's wrapped around the individuals that we serve within Sefton, and for us within the Southport and Formby localities of Southport and Formby Clinical Commissioning Group. Next slide. This is what we want to try and achieve. So many people tell me that they have to tell their story more than once. And what we're trying to do is work with localities, work with our communities, and really get into the heart of what we can do to support you with self-care and helping lifestyle changes to make it as easy as possible that you can improve your lives. And when you need services, make sure it's as easy as possible to get the right support in the right place, first time and every time. And that we hope will encourage and support the ambition that everybody lives the longer, happier, healthier life that we all deserve. Next slide. So what we did, as I've already mentioned, is work very collaboratively. There are lots of people I would want to say thank you to. I think I've mentioned some of those, particularly our communities, and I think I've missed our big chats this year and being able to have the sort of engagement with our local residents as I normally have. It's been an unusual year, but certainly in 1920 we were able before the pandemic to get a lot more interaction face to face in meetings and in venues with our residents. And as I said, this strategy, it's not just about a document that sits on a shelf. This is about really trying to achieve our ambition to improve the health and well-being of those that live within Sefton, and particularly our Southport and Formby Clinical Commissioning Group in this arena. Next slide. So these are some of our partners. and you know what it doesn't say on there is that the residents in Southport and Formby CCG, you're as important to us as all the other statutory partners, and we're really lucky in Sefton to have a really vibrant voluntary community and faith sector who are really well respected and really well utilised to support that care that we want to see within our communities. Next slide. So as we move into 2021, it's been a really unusual year, and as we move towards 21-22, we're working to achieve by the end of the financial year, for the 1st of April 22, a one integrated care system across Cheshire and Merseyside. We have got something called the Cheshire and Merseyside Healthcare Partnership, and we are members of that partnership as Southport and Formby CCG. Having said all of that, that's really important that we do things where we can on a bigger footprint when it makes sense, because it will add value and get you the services that you need. But actually what we should be about, and what my role is about, is making sure we continue in the work in Sefton, in our borough. We sometimes call it a place, but it's our borough, and we need to work consistently and collectively with all those partners who were on the slide before to make sure we're able to transform services for our residents. Next slide. This is just a diagram. You might say they've got the triangle upside down, but actually it's not for what we believe in the CCG. So it's all about you at the locality level, down in the neighbourhoods, communities, call it what you want, working with our primary care networks and working with you as our communities. And then we work alongside our local authority, localities, they're called Strategy Community First, and we work hand in glove together. So all that will achieve within Sefton for around 270, I usually say 275,000 population, the work that we need to focus on in order to deliver that ambition that I've described before. And then we call that our 80%, and then the 20%, as I've suggested before, is the things that are much easier to do once across a bigger footprint. So some of our more specialised interventions where you've got perhaps a small number of people, but they need quite a specialised service. And so that's what we're working on, and making sure we work really closely with the council and our providers to change the way that our system is working in order that it benefits you as our residents. Next slide, please. So there's been 4 pieces of work that we've particularly been working on over the last few years through a transformation programme in Sefton. As I say, the strategy is written down in the document Sefton Together and in the Health and Wellbeing Board strategy, but underpinning that strategy are the people that do and will continue to do the work to make it real and make a difference for you. So as Rob was saying earlier, the primary care networks and supporting what's called a DES, or a directly enhanced services, so incentivising so we can make changes at a very local level with our GPs. Getting our providers to work much more closely together, and some of the traditional ways of contracting, we're moving into a space where it's a much more collaborative arena between the provider and us as the commissioner, working absolutely hand in glove with our council and strengthening the things that we do commission or buy together, and then we can get the best value for the money that comes into Sefton, the Sefton pound of the public purse. And also working with the programme of work now called Shaping Care Together, which is our programme of work around our services in Southport and Ormskirk Hospital, and to some extent with all the other providers of acute care, which are our hospital services, as well as our mental health provider, Merseycare, and our community services provider, Lancashire and South Cumbria Foundation Trust. So this is a whole programme approach in all aimed at delivering care that is wrapped around our local communities as much as we can. Next slide. So during 1920, it might be a long time ago for many people, it feels like a lifetime to me, we were working together on the things that at the time were important, and we wanted opinion, as we always do with our big chat. And so some of those things at the time were about improving outpatients appointments and that whole concept of supporting to help you with self-care. We also asked you as well at our big chat last year about your views on that 5-year plan, Sefton Together. We did some work to review local health policies in 1920 and change some things as a result of the feedback and also national policy. And as I said, you know, just to emphasise, this is not about any one organisation doing things in splendid isolation. This is doing the work together. And I guess for me, as I've come out of 1920, there's lots to be proud of. There's always more that we can do, and we set off on our journey to consider that. And then, of course, we've been in a situation where the pandemic has very much overtaken much of our planning and commissioning since March this year. So I just want to finally end on saying thank you once again to all our partners, to our GP membership, and just reminding you, even at this moment, please make sure that you take care of yourselves. Remember the 3 rules about washing your hands, keeping your distance, the social distancing, and making sure that if you're out, you've got a mask to cover. Thank you ever so much, and I'll pass you over now to Martin, who is going to talk you through some of the financial aspects. Thank you. Next slide.
Hi, I'm Martin McDowell. I'm the Chief Finance Officer of the CCG. I'm here just to talk through our performance in the 2019-20 financial year. So if I could have the next slide, please. So this is the typical way that we illustrate how we spent our money in all our previous AGMs. What you can see on the right hand side of the diagram, the pie chart, is that the highest proportion, just over 51%, is spent on acute services. So that's with our hospitals in the main, and also some costs that occur in the independent sector providers such as Rennickers and Eyesight. Working our way around the chart, we have 9% working on community care services, 7% on continuing care, 9% in mental health. I will point out at this stage that mental health can also encompass continuing care and prescribing in particular. So there are some mental health costs that are also reported within those 2 sectors. We have 10% on primary care, so that's our commissioning of general practice. Also 10% in terms of prescribing, so they're the scripts that are issued typically through our general practices, presented to community pharmacists. And then finally 3% to support our programme costs, some of the work we've been doing with partners. And then finally a small 1% of our budget is spent on our running costs to provide the administrative function of the CCG on our estates. If I could have the next slide, please. So in terms of our performance for the financial year 2019-20, ending in March the 31st, 2020, we had a budget of £213 million, and that equated to £1,704 for each Southport and Formby resident. At the end of the year, the CCG reported a £12.8 million deficit, which was a significant deterioration from our previous year when we reported a £1 million surplus. In terms of the approach with our external auditors, they've reviewed our financial arrangements. They confirmed that the figure we presented was true and fair and provided an accurate position of the CCG's expenditure in year. They also confirmed that we spent our money in a way that would be expected from a regularity perspective, but they did conclude that the CCG was unable to demonstrate that it secured value for money from its arrangements, primarily down to its to not being able to deliver our planned savings targets in our various programme areas. So on that basis, the accounts for the value for money basis provides an accept for opinion. Going forward, we maintained our annual requires improvement rating in the annual assessments. Again, that reflected our hard work during increasingly challenged times, and it was particularly pleasing to see us demonstrate some good performance scores in key areas such as primary care satisfaction, cancer survival rates, satisfaction of cancer services, still providing good access for our normal elective services in terms of hospital procedures, and also around recovery rates for our IAP performance as well. So again, in all of the sorts of difficult times, we have maintained some very good performance at national level that's been recognised there by our local partners. Next slide, please. So in terms of improving performance, I've talked about most of these areas already. One of the things that we do need to really pick up upon is to work closely with our partners and providers to reduce falls in the over 65-year-olds. The other thing is about bringing in earlier diagnosis rates for cancer treatment, and that will form part of a national standard that will be measured on from the remaining part of this financial year onwards. So again, to summarise, CCG is continually improving in terms of the services that we're providing. We are operating in a challenged financial environment, but we are continuing to maintain key access and good performance in key areas. And at this point, I'll hand back over to Rob to talk through some of the questions we've had from the general public.
Okay, thanks Martin, thanks Fiona for those presentations. We've had 3 questions which have been submitted in advance to this discussion, which we'll address now. The first one, next slide please, is from Brian Clark, and I'll read the question through. It's, I note that the practices in Ainsdale and Birkdale comprise 1 PCN, but those in Central and North Southport do not form, as appropriate, the PCNs for each of these 2 areas. Why is this, and what exactly is the makeup of them? So if I just describe the PCN DES, which stands for Direct Enhanced Service, and is an offer which practices can choose to sign up to deliver a number of services as a group of practices. And those services are early cancer diagnosis, enhanced care, health in care homes, delivery of structured medication reviews, extended hours access, and social prescribing. In Southport and Formby, we've always had 4 localities, and 2 of those localities, the majority of the practices didn't feel able to sign up for that DES. However, in those localities, the practices still have committed to working closely together, but just not delivering the specifications of the DES. And where that happens, where a locality or an area of practices don't sign up, or indeed there are 2 practices in the areas that did sign up who haven't signed the DES, the responsibility falls back to the CCG to make sure that the patients of those practices still get the same services and get the same level of care with those services. So we've commissioned the Southport and Formby GP Federation to deliver that on behalf of those practices. Ainsdale and Birkdale has always been 1 locality, so they formed 1 PCN, and Formby formed another PCN. And then North Southport and Central Southport are having that specification delivered to their patients by the GP Federation. Okay, next slide, please. Okay, so the next question is from Stuart Clayton. A recent article published in the BMJ, Impact of Eye Clinic Liaison Officers, a qualitative study in UK ophthalmology clinics, concluded ECLOs are well placed in ophthalmology clinics. They can relieve pressure on clinical staff by taking on information, giving and referring duties, allowing other staff to focus on their clinical responsibilities. The impact of ECLOs may depend on efficient communication with the clinical team, being trusted by other staff, and having a good knowledge of local and national sight loss support services outside of the hospital setting. Further research could enhance our understanding of how much time and associated costs ECLOs substitute in the ophthalmology clinic. Therefore, are there any plans to commission an eye clinic liaison officer to cover the ophthalmology departments across Southport and Ormskirk? If I can ask Fiona to answer that question, please.
Hi, Stuart. I think the answer will be a lot shorter than the question, and just to say thank you ever so much for all three of the public who've written into us with the question. So, Stuart, in answer to the question that you've posed, I think the answer is yes. Our ophthalmology project lead has identified this by reviewing what you and others have informed us about, and we'll be putting that into our commissioning intentions for next year for 21-22. So there is a gap, we've identified it. Thank you for the question, and we'll be looking to commission from the 1st of April next year. Thank you. Pass you back over to the chair.
Thanks, Fiona. The last question is from Terry Nicholson. What is the current COVID-19 rate of infection per 100,000 in the 4 locations covered by Southport and Formby CCG? So, thanks for that question, Terry. The 7-day rate up to the 16th of November for our area was 233.35 per 100,000. That's a reduction from the peak that we saw a couple of weeks ago when it was 470 per 100,000. So it has come down significantly. In the 7 days up to the 16th of November, 645 people were tested positive. And again, that's reduced from 750 in the 7 days previous to that. So we're hopeful that this is a sign that the restrictions brought in when we went into tier 3 in mid-October, and then the national lockdown from the 3rd of November are really starting to have some impact, along with all the efforts of the public. And I'd just like to come back to what Fiona said before. This is a sign that things are improving for us, and it's crucial that everybody continues to follow the guidelines, washing hands, covering the face, and keeping a safe social distance from others, so that we can see those numbers keep coming down, protect our services, and hopefully start moving back towards normality for next year and going forwards. Okay, next slide. Okay, so that's the end of the formal presentations. Thank you for anyone that's watching this either live now or has taken the time to go onto the website and watch it back by download. The annual report and our accounts for 2019-20 has some more about our work, and that can be found on the website. The link's on the slide now, along with the recording of this presentation. We'd like to leave you with a slideshow of just some photos showing the work we've done and some highlights over the last year. So, thanks again for joining us.